Welcome to Practice Pulse, the show where we dive into the minds of healthcare practice leaders to uncover how they're optimizing operations, enhancing patient experience, and driving growth. I'm your host, Rahul Varshney, and today we're speaking to Alexis Johnson, Chief Operating Officer at CarePoint Health. But before we dive in, this episode is sponsored by Arcania, your partner in building custom healthcare software. If your medical practice needs a tailor-made EHR, patient portal, or automation solution to run more efficiently and improve patient experience, Arcania has you covered. With 13 years of healthcare experience, they don't just build software, they create solutions that improve efficiency, enhance patient engagement, and drive practice growth. So if you're looking to leverage technology to take your practice to the next level, visit arcania.com to learn more. Now, back to the show. Alexis, you've had such an impactful journey so far. Can you walk us through how you became a chief operating officer and what drew you to healthcare operations?
Absolutely, absolutely. So I've always kind of had a knack for healthcare. I come from a family full of individuals in healthcare on the administrative side and the clinical side. So I attended Florida A&M University, and I got my Bachelor's of Science in Healthcare Administration, and then I continued on to get my MBA in Healthcare Administration. So I've always kind of knew that I wanted to work in healthcare, just not sure what field exactly. I knew that I wasn't the most steady with my hands to do something in a more clinical setting, so the administrative setting kind of fit me a little bit better. So I started out in behavioral health, and I just kind of was drawn to healthcare. I'd learned early on that it was so many different factors of healthcare. It wasn't just one set area you had to stick with. So I've worked in endocrinology, I've worked in primary care, infectious disease, I've experienced in dentistry, which people don't understand that dental is a part of healthcare and actually very important. I've worked in behavioral health and also neurosurgery. So I have years of experience in healthcare, and I'm very passionate about it.
Well, thanks for sharing, a bit about your journey and how you came about becoming a chief operating officer. But, when we talk about practices, so every practice has its pain points. What's one major operational challenge that you have successfully overcome in your career, maybe in the current, operation or previous one? And how did you tackle it?
Ooh, well, to be completely transparent, I would say staffing. Post-COVID, staffing has been a huge issue. A lot of jobs now are pushing for remote. And in a clinical setting, that's just not something that we're able to do. Patient care requires hands-on. I mean, of course, if there is an option to do telehealth for something that doesn't require a patient to come into the office, of course, we're going to push for that. So staffing has been my biggest issue in my role in leadership across the board. Just getting individuals to want to work a full-time job in person where they could have the luxury to work remote or from home or from wherever. So that has been one of my biggest challenges as it relates to overcoming, just staying determined to find the right candidate. It is very hard when it comes to staffing a facility with individuals for the simple fact that what do you have to offer? If I could work from home in my PJs versus come in, have the commute to work, have to deal with whatever the day may brings versus the safety and the comfort of my home. So I don't really have a straightforward answer on how I overcame it. I just kind of stayed determined when it came to being able to bring someone on board.
What according to you are there some practices or certain things that you did which actually work for you?
As far as what was the question?
From the staffing point of view, which you mentioned as one of the biggest challenges, right?
You said what worked for me?
Yes.
Well, honestly, we have offered incentives at a point in time for individuals to work in office. I'm very big on boosting morale, just giving someone a thank you for being here. Every day when I come into work, I make it a point to let everyone know good morning. And before they leave, I let them know thank you for everything that you did, because sometimes it is a challenge just to wake up and make it to work.
That's true. Is it only about just the staffing, but also do you think retention is also a
Oh, yes.
challenge?
Retention is what is competitive. Healthcare, you have to think post-COVID, well, pre and post-COVID, they've offered so much money for nurses to travel, nurse practitioners, so it becomes it's a little more difficult to have someone to stay local, especially if they don't have any obligations to stay in town. They don't have any kids, they're not married, or they need some extra money. Why not pick up a 6 to 8 week contract and travel and make double what they can make from staying a full-time job? So yeah, retention is a big part as well.
And some of the things that you've done really, maybe they stand out, or are they unique, that has helped you retain more people?
Like I said, pretty much just having a positive attitude, reassuring my employees, doing team building projects and letting them know that they are also an asset to the company. I let my employees know that they're a name, not just a number. So I take it a point to learn everyone under my leadership's name. Most driving factors for people with working is money. So if you can't offer them more money, you have to offer them the morale and the work environment that's healthy for them to want to come in every day.
Nice, absolutely. Um, what would be your long-term vision for, for the future of your practice, or, your the operations that you're running in a more broader sense?
So the facility that I'm currently employed, we're a health and wellness center. We offer primary care, we offer dentistry, and we offer infectious disease services as well. So long term, I would love to expand. I would love to bring on more doctors. I would love to offer more services to the community. So we are only provide a practice that accepts insurance. So we're not a cash-based facility. We don't do like a sliding fee or anything like that. Long term, I would like to work with the other agencies to get grants of some sort to be able to provide resources and healthcare access to individuals that may be underinsured or uninsured.
That's great. At the same time, the industry is changing pretty fast, pretty
Yes.
rapidly. Um,
Yes.
what in your view, what technologies or implementations have been game changer for your operations?
AI for sure. It really helps with individuals that are able to do things on their own. So being able to schedule an appointment versus picking up the phone and calling and having to wait to get an agent. So AI has been a game changer, and it has been super helpful, especially when it comes to scheduling. A patient portal, that's been a game changer as well, being able to just directly connect with your clinical team or with the provider directly if you have any concerns. So those are two big things that I'm just super thankful for. It decreases the call volume, it helps with the patient experience, and it helps the patients feel more confident in their healthcare.
That's fantastic. I mean, talking about AI today, and of course, that itself is a rapidly changing landscape. And for your facility to have already implemented that, I think that's fantastic. Can you share a little bit more details in terms of, how you came about, deciding on how you want to implement AI, or what areas would you like to implement AI to automate, and how's that really made an impact?
Yeah. So we do have patients, we do have geriatric patients that are a bit older that don't feel comfortable using the technology. So we will always have that resource of a live agent able to pick up the phone and help them schedule or send a message to their doctor. But the ability to be able to log on to the app that we have is called Follow My Health and view your lab results, or go ahead and send a message over to the provider. That's amazing. We also use another company called Frisia, where the patients are able to upload and update their demographic information, schedule appointments, pay co-payments. So it's such a smoother transaction. When you walk in, you don't even have to do anything. You can just have a seat and they'll pull you back. You acknowledge that you're here. It has a GPS tracker to make sure that you are in a certain proximity before you're able to check into your appointments. So it's been very helpful. Of course, someone that's probably 75 years old and not very tech savvy, that's not helpful to them. So we do still have, of course, receptionists available to check patients in and update phone numbers and demographic information, or print out documents if that's the way they would like it. But it has been super impactful and improved the process of employee and patient care.
That's great. Would you say this has been so far one of the biggest impact when it comes to technology?
Oh, no, I would say the EMR systems will be the biggest impact, but that would probably be top five.
Okay. And do you see that changing in the times to come?
Which what changing?
In terms of how technology is really in the way that technology is playing a role in overall practice
This point,
efficiency.
yeah, technology is inevitable at this point, and it's really one of those things you have to get on board, or you'll get left behind because so many other practices kind of jump on board sooner than later. So then it's kind of like, where are we in the gist of things? For example, our patients, they're accustomed to the ability to speak directly with their providers through the patient portal, or upload documents directly for the providers to see and kind of be self-sufficient. And if they go to another doctor and it's not that same way, they're kind of looking at them like, what's going on here? So yes, I definitely see it constantly just growing. 5 years ago, I wouldn't have seen a world where AI exists and patients were able to do all of these things on their own. So yes, I can say in the next 5 years, I can only imagine how far technology in healthcare would have been or how it would have gone.
It's really great to see, the kind of implementations that you've already made in your practice when it comes to technology and already leveraging something like AI. But do you still feel that there may be some workflows in your practice where you see even further opportunities to maybe streamline or digitize or maybe automate some of those processes or workflows?
Absolutely. There's always room for improvement, especially with our EMR system. I've worked with several different ones, so I definitely have seen where we could, like you said, digitize certain things that we still are using more paper-based or things that are not, in the system. So yeah, there's always that opportunity for growth or for technology to come in and help make things a little smoother.
That's great. Is that something that would be on your radar for maybe
Oh
your?
yeah. Oh yeah. I'm always in the market to make this transaction and the experience smoother.
Well, but then sometimes you're also budgeted by, limited by maybe budget or time. But let's say you had unlimited budget or and time. What kind of technology or implementation or maybe a software or a tool would you love to build or adopt in your facility?
So I'm a little biased, but I love Epic. That's one of the EMR systems that is world renownedly known, and it's amazing. They have something that is called Epic Care, where you're able to go in, even if you don't have Epic as the EMR system, and access documents from other doctors' offices or hospitals. And that's amazing. I'm always pushing for a universal EMR system. In a perfect world, that will exist, right? But as of now, it doesn't. So Epic for me and Epic Cares is something along those lines, where even if you don't have that EMR system, you're able to go in and still find documents on your patient, because it provides continuity of care. If your patient is 6 hours away in the hospital and you have to wait to request the records and wait for the records to come back, that's not beneficial to the patients. Whereas you can log into a system and see, okay, I'm the primary care provider. My patient is in the hospital for a hypertensive crisis. I can go in and know that this person needs to follow up with me immediately and know and prepare myself for the appointment that's to come. We try to do at our practice, we try to get those patients that are admitted to the hospital in within a 7-day turnaround. This will make the process seamless because we already are aware of what's going on with them. We can track while they're in the hospital, any medication changes, anything that's going on. So in a perfect world with an unlimited budget, that would be something that I would push for.
Well, I mean, all of this you'd look at to grow your practice, right? But overall, what do you believe is required or key to sustainably growing a practice today?
You said, what is the key to
growing a practice today, apart from maybe leveraging the tools?
I would say a good foundation. So having those employees, providers that bring forth the can-do attitude, that is super important. The technology is great. All of that is perfect. But if you don't have individuals that are willing to work with you and work with the team, it's kind of pointless to have all these amazing aspects and things with the company. So I would definitely say having a great team with you, willing to learn, easy to teach, coachable, that plays a big part in healthcare in any industry, honestly.
Right. That's great. Maybe a little bit about yourself. So, as you reflect on your own journey, what has been the most rewarding part of leading operations in a healthcare landscape?
Yeah. Oh, that's a good question. So I would just say the most rewarding for me would be the journey. I'm originally from Deerfield Beach, Florida, which is in South Florida. It's a very small town. And to be where I am today is amazing. So the opportunity to make stops on my journey in different aspects of healthcare and help individuals along the way get to their goal has been the most rewarding aspect for me operationally with my job, making improvement. Like I said, being able to incorporate different softwares and technology to make my employees' jobs much easier. That's super satisfying. It's always a saying where you should work smart, not hard. And I think technology was created for that purpose. So I'm always in the business of wanting to make the job more efficient and make it a little less difficult by adding on tools to help.
That's great. Is there a person or something that inspires you to keep pushing the boundaries in your role?
In my role,
Yes.
well, I'm very big in my faith, so my religion keeps me going. I would definitely say I have, oops, my, oh, there we go. My religion, as I mentioned, and I would definitely say just individuals around me, my family, my sister, my mother, my mentor, um, just individuals that are around me keep me motivated.
That's nice. And maybe a little bit of advice, if there's a new chief operating officer that's stepping into your shoes tomorrow, or there's a budding, operations manager, growing up the roles, what advice would you give to them?
Never give up. Stay focused, stay determined, stay true to who you are, and the journey is worth it. Sometimes it does get difficult. It's not always cut and dry. Every day won't be a good day, but keep pushing forward because it does get easier over time.
Uh, Thank you so much, Alexis, for being on the show and really sharing your insights in terms of practice growth, your journey so far, and then advice for other operating officers or those looking to step into your shoes as well. Thanks really for being on the show.
Absolutely. Thank you so much.